Welcome. Hope everybody's doing well. I'm just connecting with you guys to give you an introduction and a pre-brief to our vSimulation. Now I know vSimulation isn't new to you guys. You did use it in term 6. So the process is the same. The scenarios are just the maternity scenarios. So to access those, you're going to go to your perinatal. You probably already know how to access your vSimulation, but just in case you need a refresher, if you go to your on and off campus guides, then you're going to see the vSim information and resources. Now I do have the link right to the point built in right here, and I have set up a class for the perinatal vSimulations maternity scenarios. So my classes join a class, and the class code is all here. And everything should be working for you. You should already have access to this. If you run into any glitches or problems, let me know and I can troubleshoot it from my end. And you can also get help through the point as well. So if we go to the point, and then you would enter for students. I'm obviously going to go through for faculty. Go to my content. This is going to look familiar to you guys. You should already have your maternity and pediatric. And then we're going to go to vSim for nursing. Alright, so the scenario that we're going to start with first is Fatime Sanogo. So pre-brief with vSimulation, what's our expectation for using vSim in class? Well, we're going to be using it as part of our asynchronous learning in our on-campus labs. So the expectation is that you will have completed this prior to the start of the week it's assigned, that Thursday's lab. But you can do it asynchronously or at your own time. So I'm allotting 2 hours for you guys to work through the suggested readings, the pre-simulation games, the vSim itself, the post-simulation quiz, and then we will come back as a group to discuss and debrief what actually happened in the vSims. So you guys kind of already know there's suggested readings, there's the quiz, the vSim itself, there's a post-simulation quiz. I'm not assigning any documents per se, but I do expect that you'll do some self-guided debrief about that scenario that you just completed while it's fresh in your mind. And then you will need to keep doing the scenario until you get at least an 80%. So you want to put yourself in the shoes of the nurse or the caregiver that is going to be providing care for this client. And we've got our patient introduction. So we've got Fatime Sanogo. She's a 23-year-old primiparous female from Mali. It's her first hour after vaginal delivery. So right away, again, start using your critical thinking, doing your patient data collection, starting to think about what might be the priority nursing diagnoses, what are some of the concerns or issues that you should be assessing or watching for. We know that Fatime was admitted yesterday at 600 hours for oxytocin induction in labor secondary to post dates, so she was 41 and 47 weeks. Again, ask yourself, what does that mean? Is there any relevance to that information? She declined all her pain medication during labor. Following a prolonged second stage, she delivered a vigorous female at 06:05 hours with APGAR scores of 9 and 9 and weight of 9 pounds 0 ounces. The patient contracted a second-degree perinatal laceration during delivery. This has been repaired. So again, we're in that data collection phase. We're getting report. Think about the relevance and the pertinence of this information. So is there anything in there that is increasing her risks? Think about your postpartum nursing care plan. Are there any priority nursing diagnoses that you would be maybe putting more emphasis or relevance on now based on the report that you've gotten? Placenta was delivered manually at 06:35 hours by Dr. Schultz. Bleeding was controlled by fundal massage and infusion of the remaining oxytocin that was in the induction bag, which was still running at 20 mils an hour. And there was approximately 100 mils left in the bag. So Fatime was just up to the bathroom, was unable to void. She's now resting. Father of the baby's at the bedside, holding the baby and sending text messages from his phone. Fatime does not speak English fluently. She's only been in the country 7 months. Now you are the nurse entering the room to assume care for the patient and perform the second of 4 assessments that you would do in that initial 4th stage of recovery, or 4th stage, and doing your frequent postpartum assessments. So again, is there some priority nursing diagnoses? Right away, there's a lot of things in here that I'm flagging, right? So hopefully you guys are as well. We know that she was oxytocin induction. There's certainly potential repercussions for that or higher risks. She declined all pain medication. Not necessarily a risk, but certainly making note of that. She had a prolonged 2nd stage. The fact that she delivered a vigorous female infant with APGAR scores of 9 and 9, that's not concerning. Those are all good things. But a weight of 9 pounds, so is that within our normal range? Are we starting to push it a bit? Start thinking about your risks for hemorrhage, our tone, trauma. We've got our 4 T's, so there's always tissue, tone, trauma, thrombocytopenias. So think about all of that. Placenta was delivered manually. We had to control the bleeding with fundal massage, but again, is that normal? Abnormal immediately after the delivery of the baby and placenta. She's just up to the bathroom and she could not void. Again, ask yourself, what are some of the things that potentially contribute to increased bleeding, or what are risk factors? What are some of the nursing interventions we do routinely to help decrease risk of bleeding? And then, of course, we have some that does not speak English fluently. Okay? And now you've gone in to take care of her. Now, do we have Richie and Kyle and Carmen maternity and pediatric nursing? No, we have a different textbook. But if you go into your postpartum chapter, you've already done a lot of these readings, and you spend some focus readings on postpartum care and assessments, especially on your bubble lists. You're certainly going to want to review that with a strong focus on our postpartum hemorrhage. Okay. Now you always want to take advantage of these. Look on your oxytocin. So all of these embedded, we have access to these through our AHS site, all our monograms. So she's had these medications, so what is it? Why do we give it? What does it mean? What should we be monitoring, assessing for? All of that you want to be looking at. Same as misoprostol. If we're doing blood product administration, we would want to be up on some of our cross-match and diagnostic tests. And here's some really, really good information on procedures. So postpartum hemorrhage management, fundal assessments, how to do catheterization, how to give oxytocin administration postpartum. So all of these you're going to want to spend some time and look at. All right, so I'm hoping that gives you a good foundation on going in and continuing on this on your own. Go ahead and do that pre-simulation quiz. Do your actual vSim. Do your post-simulation quiz. And then go on Blackboard for your guided reflection questions. And then also, when we come back together for a debrief, you're going to want to have access to your progress report of how you did and how things went. So you know where you get that sheet that basically has all the, hopefully not too many red X's. Though I must admit, I will admit that the first time I did this, I did not do very well. Partly it was learning the program, and partly it was I wasn't waiting for doctor's orders, and I was just going ahead and doing stuff. So I had to certainly back that off and and follow those very proper foundational procedures that need to be doing, especially as nursing students. All right, if you have any questions, you guys know how to get hold of me. Otherwise, enjoy, have fun, and I look forward to getting together with you at the beginning of the next lab in order to debrief Fatime Sanogo's vSimulation. Okay, take care.